Hello everyone. Today we are going to see about clavicle. Clavicle. The clavicle is a long bone, located horizontally on the anterior aspect of the body, at the junction of root of the neck and trunk. The bone has a cylindrical part in the middle, called shaft dot, and two ends, lateral and medial. The clavicle articulates medially, with the sternum to form sternoclavicular joint and laterally, with the acromion process of the scapula to form acromioclavicular joint. Function: acts as a strut, for holding the upper limb far from the trunk so that it can move freely. It transmits forces from the upper limb to the axial skeleton, sternum. Peculiarities of the clavicle. It is the only long bone that lies horizontally. It is subcutaneous throughout. It has no medullary cavity. It is the first bone to start ossifying. It is the only long bone which ossifies in membrane. It is the only long bone which has two primary center of ossification. Anatomical position, side determination. The side of the clavicle can be determined by holding the bone horizontally, in such a way that its flattened end is on the lateral side, and its enlarged quadrangular end is on the medial side. The shaft is slightly curved, so that it is convex forwards in its medial 2/3, and concave forwards in its lateral 1/3. The inferior surface is grooved longitudinally, in its middle 1/3. Parts and features. Lateral end. The lateral or acromial end is flattened from above downwards. It bears a oval facet that articulates with the acromion process of the scapula to form the acromioclavicular joint. Medial end. The medial or sternal end is quadrangular and it bears a saddle-shaped articular surface, which articulates with the clavicular notch of manubrium sterni to form the sternoclavicular joint. The articular surface extends to the inferior aspect, for articulation with the first costal cartilage. Shaft. The shaft of the clavicle is divisible into the lateral 1/3 and the medial 2/3. Lateral 1/3 of the shaft of the clavicle is concave forwards and flattened from above to downwards. It has two surfaces, superior and inferior, and two borders, anterior and posterior. Surfaces. Superior surface is subcutaneous between the attachments of deltoid and trapezius muscles. Inferior surface consists of elevation called conoid tubercle, and a ridge called trapezoid ridge. Borders. Anterior border is concave forwards. A small tubercle called deltoid tubercle is present. Posterior border is convex backwards. Medial 2/3 of the shaft of the clavicle. It is rounded or cylindrical in shape and has four surfaces. Anterior surface is convex forwards. Posterior surface is smooth and concave backwards. Superior surface is rough in its medial part. Inferior surface has a rough oval impression at the medial end, for costoclavicular ligament. Lateral half of this surface has a longitudinal groove called subclavian groove, and the nutrient foramen lies at the lateral end of the groove. Muscle attachment. Deltoid arises from the anterior border of the lateral 1/3 of the clavicle. Trapezius inserts in the posterior border of the lateral 1/3 of the shaft of the clavicle. Pectoralis major. Clavicular head of pectoralis major muscle arises from the medial 2/3 of the anterior surface of the shaft of the clavicle. Subclavius inserts into subclavian groove, on inferior surface of the middle 1/3 of the clavicle. Sternohyoid originates from medial end of clavicle. Capsular attachment. Capsular attachment on the medial end of the clavicle. Fibrous capsule of the sternoclavicular joint attaches all around the margins of the articular surfaces of the medial end. Capsular attachment on the lateral end of the clavicle. Fibrous capsule of the acromioclavicular joint attaches all around the margins of the articular surfaces of the lateral end. Ligament attachment. Interclavicular ligament attaches superiorly on medial aspect of medial end. Articular disc attaches posterior superiorly aspect of the medial end of the clavicle. Costoclavicular ligament. The oval impression on the inferior surface at the medial end gives attachment to the costoclavicular ligament. Sternoclavicular ligament. Anterior sternoclavicular ligament attaches to the antero-superior aspect of the sternal end of the clavicle. Posterior sternoclavicular ligament attaches to the posterior aspect of the sternal end of the clavicle. Coricoclavicular ligament. Conoid tubercle and trapezoid ridge gives attachment to the conoid and trapezoid parts of the coricoclavicular ligament. Relation. The subclavian vessels and cords of brachial plexus passes towards the axilla, lying between the inferior surface of the clavicle and upper surface of the first rib. Clinical anatomy. Clavicle fracture is common by falling on outstretched hand or by a direct hit. Cleidocranial dysostosis means congenital absence of clavicle.